Now for the next aspect we should be looking at under the cancer of the cervix, we look at the treatments for cancer of the cervix. That means various types of treatments that you might actually want to employ for this. Okay, so for the treatment for cancer of the cervix, of course you can see this image summarizes it. You can do surgeries, you can do radiotherapies, you can do chemotherapy, you can do immunotherapy. Now different reasons could actually come up which will make you want to choose a particular type of treatment. You understand? So treatment depends on the stage. These are the reasons. You are trying to talk about the age of the patient. What's still the life expectancy of this patient? You are trying to see if this patient still has interest of giving birth to children, okay, or they are done with their reproductive life. They're also trying to look at, okay, at this setting, what are the available resources? Like, what can I be able to do? Okay, so early stage disease, that's based on progression of the disease. Now you can do conization, where you basically kind of like chop up the area that is being invaded by the cancer cells. Simple or radical hysterectomy, you can remove the uterus or remove the cervix. Okay, then trachelectomy. Okay, then lymph node assessments to see if there's any involvement of the lymph nodes. Then if the disease is locally advanced, that means you have the disease there, is spreading but just within the territory. Okay, you can use chemoradiation. That's combination of radiation and chemotherapy. Okay, so advanced metastasis is the disease is widespread. Okay, palliative chemotherapy, use drugs like cisplatin, paclitaxel, topotecan. Then targeted therapy and immunotherapies like bevacizumab, pembrolizumab. Okay, so supportive cares like blood transfusions. The patient is having anemia issues because of that bleeding that will usually be occurring here. Antibiotics if there is risk for infections. Nephrostomy, then psychosocial support and counseling.